welcome to Medical Dialogues. I am Dr. Bhumika. Let's look at today's top medical news. Study links adverse childhood experiences in firstborns to mental health issues in siblings. Children are nearly 3/4 more likely to develop mental health problems between the ages of 5 and 18 if the firstborn child in their family experienced adversity during their first 1000 days, finds a new study led by UCL researchers. The study published in the Lancet Public Health found that mothers whose firstborns had experienced adverse childhood experiences had a 71% increased risk of having children with mental health problems compared to mothers whose firstborn did not experience adversity. As part of the study, researchers analyzed linked GP and hospital health records from 3,33,048 first-time mothers and their 5,34,904 children born in England between 2002 and 2018. They focused on 6 different forms of adverse childhood experiences in the firstborn child recorded during their first 1,000 days of life from conception up until the age of 2. These included child maltreatment, intimate partner violence, maternal substance misuse, maternal mental health problems, adverse family environments, and high-risk presentations of child maltreatment. Can traffic delays increase unhealthier eating choices? New research shows that traffic delays significantly increase visits to fast food restaurants, leading to unhealthier eating for millions each year. Findings are published in the Journal of Urban Economics. Researchers had access to daily highway traffic patterns over more than 2 years in Los Angeles, along with data showing how many cell phone users entered fast food restaurants in the same time period. With these data, the team created a computational model showing a causal link between unexpected traffic, slowdowns, and fast food visits. This pattern held at various time scales, including 24-hour cycle and by the hour throughout a given day. When analyzed by the day, traffic delays of just 30 seconds per mile were enough to spike fast food visits by 1%. Why some people are more susceptible to developing drinking problems, study finds. Rutgers Health Research have discovered that brain immune cells from people with a high genetic risk for alcohol use disorder behave differently than cells from low-risk people when exposed to alcohol. The study in Science Advances could help explain why some people are more susceptible to developing drinking problems and potentially lead to more personalized treatments. The research team took blood samples from 2 groups of people, those with both high genetic risk for alcohol use disorder and diagnosed alcohol problems, and those with low genetic risk and no alcohol problems. They transformed these blood cells into stem cells and made them develop into a type of brain-based immune cell called microglia. They then exposed these 2 groups of cells, one from the people with a high genetic risk for alcohol use disorder and one from the people with a low risk for alcohol use disorder, to alcohol levels that mimic those seen in the blood following alcohol use. Link between maternal vitamin D during first trimester and pregnancy outcomes, study finds. Low vitamin D levels in the first trimester of pregnancy are associated with higher rates of preterm birth and decreased fetal length, according to a new study led by researchers in the Penn State Department of Nutritional Sciences. This research provides evidence that early pregnancy or even preconception may represent critical time points for intervening with women who have low vitamin D status to optimize pregnancy outcomes. The findings are published in the American Journal of Clinical Nutrition. The researchers tested blood samples from 351 women, recruited pregnant women across the United States between 2010 and 2013. Vitamin D was measured in terms of nanomoles per liter of blood. When the researchers compared outcomes for women with vitamin D insufficiency to women with sufficient vitamin D, they found no statistical differences in pregnancy outcomes. However, when the researchers compared pregnancy outcomes across a wider range of vitamin D concentrations, they found that pregnant women with first trimester vitamin D concentrations lower than 40 nanomoles per liter were 4 times more likely to experience a preterm birth compared to women with vitamin D concentrations more than or equal to 80 nanomoles per liter. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.